Y'all, if MedSurg feels overwhelming and nothing is sticking, this is exactly how I studied and passed MedSurg 1 and 2. But disclaimer, y'all, before we get into this video, like this video, save it, share it with another nursing student so it can help somebody else too, okay? I just want y'all to engage with this video, because the more you engage, it'll push it out to the algorithm and reach the people who really need to see this video. And that's why I'm doing what I'm doing, okay? So, okay, tip number 1, start by understanding what the condition is and what is happening inside the body. So ask yourself, what organ or system is affected and how that problem disrupts normal function. For example, is the heart not pumping effectively? Are the lungs not exchanging oxygen properly? Or are the kidneys not filtering waste like they should? When you understand what's going wrong internally, everything else starts to connect instead of just feeling random, right? Tip number 2, focus on risk factors. That's very important. And separate them into modifiable and non-modifiable. So non-modifiable risk factors are things the patient cannot change, like their age, genetics, their sex, past medical history, those things are non-modifiable. Modifiable risk factors are things that you can address or improve, like smoking, diet, your physical activity level, obesity, or alcohol use, right? So this helps you understand prevention, patient teaching, and priority nursing actions. Tip number 3, study clinical manifestations, meaning how the condition shows up in the patient, right? Know which signs and symptoms are expected and which ones indicate the patient is becoming unstable. So for example, mild shortness of breath may be expected, right? But sudden chest pain, altered mental status, or dropping oxygen levels are red flags. Those are unexpected. So pay close attention to symptoms related to airway, breathing, circulation, and neurological status, because those will always take priority. Tip number 4. So after that, right, learn how the condition is diagnosed. Focus on key labs, imaging, or tests that confirm the diagnosis and what abnormal findings support it. So for example, elevated lab values, abnormal imaging results, or specific test findings that point directly to that condition. Okay, so you don't need to memorize every single value, every single lab value, right? But you do need to recognize what's abnormal and why it matters. Number 5, then you want to move into treatment and nursing interventions. So understand the medical treatment, such as medications, right? Procedures. For example, medications control blood pressure, manage pain, reduces inflammation, and improve oxygenation, right? Procedures may include things like surgery, catheter placement, wound care, or oxygen therapy. Also, understand what your role is as a nurse. This includes monitoring vital signs, assessing the patient's response to treatment, managing side effects, maintaining safety, administering medications correctly, and knowing when to intervene or notify the provider if the patient's condition changes or worsens. And finally, you want to focus on patient education. So think about what the patient needs to know to manage their condition safely, to prevent complications and avoid readmission to the hospital. This includes how and when to take medications, lifestyle changes they need to make, warning signs to report, and when to follow up with their provider. So this is the exact study method I used that helped me pass MedSurg 1 and 2 with a B+ in both classes. Okay, so listen, that's it for this video. But remember, I'm gonna always leave y'all with this, because this is so super duper important, right? Never in this lifetime or the motherfucking next dim your light for anybody. Stay lit.